Yo, well, what an amazing man. Ah, they say the truth is like a lion. Set it free and it will defend itself. So there you go, there's some truth. Nobody can tell me nothing now about, you don't know what you're talking about. The people don't know what they're talking about. That's an actual doctor, a practicing doctor. And yeah, he is brilliant. I'm going to connect him with some more people. Let's bring in Dr. Holistic for... No, I'm hot. It's hot here, man. It's like 30 degrees. I'm bringing Dr. Holistic for a summary.
What's
Yo,
good, brother?
well, my brother.
Good, man. That was an ear and a mouthful. Yeah, man. It's we are truly living in some very precarious times, man. So it's good that you're bringing people on like him, because the unfortunate thing, as you sort of saw, was like censorship is crazy now. It's almost as crazy as it is. Like when I lived in Japan, like you could never do anything like this. Like
What do
ever.
you mean?
Like have these kind of lives and have these kind of conversations. But even more so like in China, because you know in China you can't even have Facebook.
Yeah, they got their
So
WeChat and that's it.
yeah, that's it. Like so, you know, I think people should really take advantage of the fact that right now we still have this kind of access. And we're still able to share this kind of information, and people like you are able to get people like him on and speak directly about things that aren't being talked about, because the media is really the media is really selling us a story, and it's a good one, but it just doesn't add up, so yeah, I'm
Did you
really
did you
glad.
did you see the video that I posted and a few people posted about the nurse who's working in the New York hospital and talking about how the minorities are being murdered in there and she doesn't know who to speak to.
Yeah, man. So I've seen that video. I seen, a couple of weeks ago, another doctor came out and he was talking directly about the ventilators and how they're being misused. A couple of respiratory therapists that are in New York. My sister is actually a nurse. She's in New York right now. So, yeah, man, you're hearing people who are, see, the unusual thing about medicine is this. You have two types of healthcare professionals: the ones who learn what's in the book, and if it's not in the book, they do not do it. It doesn't make sense to them. And then you have the health.
Oh, wait, it's doing that again. Try bring him again. Sorry, carry on.
Yeah. But then you have the healthcare professional who is capable of thinking. Like when something doesn't make common sense, they ask questions. And I think what you're starting to see is a lot of the people who actually have common sense are actually starting to come out and speak more about it, because things aren't starting to add up. Especially like all of the things he talked about, even like the false positives with the test for the coronavirus. It's a RT-PCR test. The man who invented the test, Kerry Mullins, he said in the 1980s, this test is not to be used for determining a diagnosis for viruses. And he got a Pulitzer for for actually developing the test. But he said directly, it's not to be used for that. What it's to be used for is amplification. Meaning what they do is they take one segment of the RNA or DNA, right? And then they amplify it. And you have to amplify it at least 36 times. Okay?
Okay.
If you amplify it above 45, then you're going to start to get false positives. Okay?
Right.
But even if you amplify it too low, like below 35, nobody will be positive. So
Right.
you can see if you if you navigate the test in a certain way, it'll get way more positive. You can even go online now. The president of Tanzania, he just came out. He said that they used the test and they were able to find false positives with goats and papaya.
Goats, birds, rabbit, and papaya. And I really like the way that he did that, because he didn't say anything about it. He didn't tell people in the country that anybody had it, so he didn't panic everybody. He
Right.
just got the tests. Sorry, he got samples. He sent them, naming them down as people, not
Right.
as the fruit, not as the goat, not as the bird.
Right.
And out of the 8 samples that he sent, 4 of them came back was positive with coronavirus. So essentially what they're doing is they've taken this genetic material that is in the lungs, because they haven't positively isolated the coronavirus anyway.
Right.
They took the genetic material from some people. Can you hear me?
Yeah, I can hear you.
Okay,
Your screen is
I'm frozen.
calculating. Yeah. I
I
can hear
mean,
you, but
you
your
can hear me,
screen
but
is frozen.
I'm frozen like this.
Yeah, I can still hear you though.
You can still hear me?
Yeah.
Oh gosh, it's crazy, no?
Oh man.
Like, I'm still frozen, you're still frozen. Wow.
Yeah, it's pretty crazy, man. It's crazy.
I can't end it. I'm trying to end it. I can't end it. I can't kick you out. I can't write a comment. Can't actually do anything. The whole thing's just frozen.
Really?
Yeah, this is crazy. Let me wait. Stay there though. Let me record it so that I could just get a record. Can you hear me?
Yeah, I can hear you fine.
Yeah, I'm just gonna record it on my iPhone so I can just get a record of. So this is the level of censorship. There were 825 people in here. Right now, I am completely frozen, and Dr. Holistic is completely frozen. But you can hear me, right?
I can hear you, and I mean I can see my screen frozen, but yeah. Yeah, but this is
Right.
what's pretty much been happening all night as I was watching you interview. You did a really good job, by the way, interview Dr. Buttar. But yeah, this is what's been happening all night. So you've heard you consistently hear the talks about censorship, but now you're actually seeing it.
Right. So basically, when we started talking about the false positives, it froze my phone, and now my phone is completely not working. And it's never done it even like this before. It's done it, kicks people out, but this is crazy. So I'm
Yeah.
saying personally, I, Chakabars, do not consent to censorship. And what about yourself, Doctor?
I absolutely do not consent to censorship. Yeah, man.
All right. And you know, I don't know who's in here or who's not here in here anymore, because we can't press anything.
Well,
I can
the
just
interesting thing is I see people saying that they can see me move and talk. They can hear you talk, but you're like completely frozen.
mad.